Hey sonographers, let's get into polydactyly versus syndactyly. So polydactyly is meaning poly extra, so you can have a post-axial, which is an extra digit on the pinky side, or a num, like a nubbin, or preaxial, which is towards your radial bone, towards your thumb. Syndactyly is when the digits are fused or the skin in between the digits are fused, so it doesn't necessarily mean bone and skin, it can just mean skin. Here's an ultrasound image above. On the top left is normal digits, and on the top right is our syndactyly, which is fused with the two bones. Here there is an outline of what different types there are. So there's a simple, which means the fingers are joined by skin and soft tissue. There's complex, which means the bones are joined together, which that last ultrasound picture showed. And then there's the complicated, which includes bones and tendons and ligaments. Now jumping into our polydactyly, this is a 3D scan of a polydactyly post-axial, which means there's an extra digit on the pinky side. So this is super clear. You can see it 1, 2, 3, 4, 5, and then the 6 is towards the pinky side. Whether that is a full polydactyly with bone, you can actually assess it on ultrasound because you'll be able to see the bone in that extra digit, or if it's just like extra tissue, soft tissue that you can see. But clearly this is 6 digits. Same thing with the toes. These are toes polydactyly post. So it's an extra digit and you can clearly see 1, 2, 3, 4, 5, and then a bone coming off the towards the pinky side, which is our post-axial. This is a diagram of post-axial type A and B. Type A is with bone and B is without bone, and then you have our preaxial, which is different types. Basically on ultrasound, you want to make sure when the babies have their hands closed during your anatomy scan, you want to make sure when they open their hands, you count the digits. I mean, it's so difficult to get a full nice hand shot, but once they do that, like I said, make sure you count all 5. Here's another actual image of a preaxial digit of the left hand. So syndactyly and polydactyly can be genetic, either autosomal dominant or autosomal recessive. Autosomal recessive basically is less common, and that's associated with genetic abnormalities such as Down syndrome or Ellis-Von Crevard syndrome. The most common kind is the autosomal dominant, and that is when it's an isolated finding. So sometimes the mothers or the grandmothers or a family member will have that extra digit on the hands, on the toe, and whether they mention it or not, like most of the time when you see it and you ask, they're like, oh yeah, you know, a cousin or aunt has that. So definitely good to get family history if you do see it. Make sure on ultrasound, like I said, once the digits open, you get a clear shot of all the bones in the fingers and the toes, and yeah, you should be golden after that.